welcome to AirDiathermy. We are so happy to have you aboard our flight. On behalf of the entire crew and myself, I would like to design you into two sections. You are the thermal section and you are the non-thermal section. For the thermal section, the effects y'all will be feeling are an increase in metabolism, increase in blood flow, increased tissue temperature, diminishing pain perception, and a general muscle relaxation. And then for the non-thermal section, y'all will just have soft tissue healing. For the advantages of our airline diathermy are that we heat deeper than other modalities such as air ultrasound, and we also heat areas 25 to 30 times larger than ultrasound. Some of our disadvantages, however, are that our plane tickets could be kind of expensive, and our machinery can be big, bulky, and not as portable as, say, other airlines. Indications to board our flight diathermy today are if you are doing it prior to joint mobs, if you have post-acute sprains, strains, or contusions, if there's any pain, tendonitis, tendinosynovitis, bursitis, any myofascial trigger points, and joint contractures. Contraindications to where you should not board our flight today are if you have any general heat contraindications, if you have a pacemaker, if you are pregnant, if you have a malignant tumor, if you have a fever, ischemic areas, if you have any peripheral vascular disease, any tuberculosis or signs of infection. You do not want to board. You do not want to have diathermy on your eyes or your genitals or growth plates, or if you have any herniated discs. Thank you. I would also like to remind you that it is not recommended to fly AirDiathermy if you have any of the following conditions: surgically implanted metals, pelvic or lumbar exposure during menstruation, if you have atrial or venous circulatory disorders, osteoporosis, wound dressings, over tissues or organs that have a lot of high fluid volume, over acute inflammation, active hemorrhage, or sensory impairment. We are now ready for takeoff and pre-application of the procedure. Please make sure that you are on the right airplane and that you're using the right modality, diathermy. Make sure that the equipment is ready, so that the equipment's on and you put it in the right position. Please make sure the drum is clean and dry when you're using it. Make sure the patient is prepared physically, so any removal of jewelry or really tight clothing that can heat up tissue overly. Also psychologically, so explain the procedure to the patient, which I'm doing now to you. And please check for precautions when you're explaining to the patient. Also, make sure the patient is in a comfy position, so leaning back in your chairs like you are right now is perfect for y'all. And make sure there are no open wounds or rashes when the diathermy is applied to that area. Now request your full attention as our other flight attendant, Laura, demonstrates the modality.
First, you want to position the drum over the area that is injured. In this case, it is the shoulder. And if it makes the patient more comfortable, a towel can be placed between the drum and the skin, but this is not necessary. Once the drum is in place, the machine needs to be turned on. Next, depending on which section you are in, a mode is chosen. This section is non-thermal, so the variable setting is selected. Pulse frequency and pulse duration are chosen next, and they would both be low if the machine did not have preset settings. Finally, the start button is pressed in order to initiate the treatment. The flight treatment time will run from 15 to 20 minutes. On the other hand, for the thermal section, there are more options for the mode. 1 delta for mild heat, 2 delta for moderate heat, and 4 delta for maximum heat. As mentioned before, these settings are preset with the pulse frequency and pulse duration, but both would have a high setting if this was not the case. The start button is then pressed to begin treatment. This flight treatment will also have duration of 15 to 20 minutes. Both types of flights can only be collectively used 1 to 2 times per day until the treatment goals are achieved.
Hello everyone, we have just been cleared to land. Please make sure that all the equipment is removed, buttons turned back to 0, and make sure that everything is clean. On behalf of AirDiathermy and our entire crew, I would like to thank you for joining us on our journey. please make sure you schedule your next visit or treatment with us. Thank you so much.
Maintenance, you want to make sure all the cables are in proper repair and that the drum is looked at every once in a while.